Hi everyone, my name is Dr. Shiva Hadadianpur, and today I'm going to talk about miscarriage, its causes, symptoms, and how to deal with it. First of all, it's better to know what miscarriage is. Spontaneous abortion or miscarriage is the spontaneous loss of a pregnancy before the 20th week. If it happens before 13 completed weeks, it is called early pregnancy loss. Regarding the importance of this topic, you should know that about 10 to 20% of known pregnancies end in miscarriage, but the actual number is likely higher because many miscarriages occur very early in pregnancy before you might even know about your pregnancy. These are people who go to infertility clinics due to fertility problems, and after various studies, it becomes clear that it is not a problem of fertility, but the fertility product is aborted in the early stages before the person becomes aware of her pregnancy. Now, the most important question that pops into mind is that what causes miscarriage? About 50% of early miscarriages happen when the embryo doesn't develop properly. This is often due to an extra or missing chromosomes. Chromosome problems often result from errors that occur by chance. If an egg or sperm has more or fewer chromosomes than normal, the embryo also will have an abnormal number of chromosomes, which lead to miscarriage. And this is the most common cause of miscarriage. Other less common causes include uterine cavity abnormalities, infections, hormonal disorders, thyroid diseases, uncontrolled maternal diabetes, smoking, and alcohol. For many people, the question is miscarriage a woman's fault? Could she have prevented this phenomenon and experienced a normal pregnancy if she has taken more care during her pregnancy? Are there certain activities that cause miscarriage? It is important to understand that miscarriage is usually a random event. No one can be blamed when it happens. Working, dancing, exercising, stress, sex, and birth control pills do not lead to miscarriage. Few medications are accused of causing miscarriage. Some women who have had a miscarriage think that it was caused by a recent fall, fight, or stress, but the truth is something else. These things only happened around the same time, and there was no cause and effect relationship between them and miscarriage. Now, another question arises. How does age affect the risk of early pregnancy loss? As we can see in the graph, the chance of miscarriage increases as a woman gets older. For women over age 40, about 40% of pregnancies end in miscarriage, and it is mostly related to chromosomal abnormalities. Some evidence also shows that chromosome abnormalities in the embryo increase as men get older. The most important thing is how we can reduce the risk of miscarriage. Unfortunately, in many cases, the root cause of miscarriage is unknown and we cannot prevent it. However, there are many ways to reduce the risk of miscarriage, including stop smoking during pregnancy. Every cigarette you smoke contains over 4,000 chemicals. So active or passive smoking when you are pregnant harms your unborn baby and restricts the essential oxygen supply to your baby. This leads to spontaneous abortion. Note that Electronic cigarettes or vapes also increase the risk of miscarriage, but current evidence shows that they are less risky than regular cigarettes for spontaneous abortion because e-cigarettes don't produce carbon monoxide. And as you know, carbon monoxide is very harmful to the developing fetus. Another way to reduce the risk of miscarriage is stop drinking alcohol or using illegal drugs during pregnancy. Alcohol passes from blood through the placenta to your baby. The baby's liver doesn't mature until the later stages of pregnancy, so the babies cannot process alcohol efficiently, and exposure to alcohol has a very bad effect on their developments. Drinking alcohol during pregnancy increases the risk of miscarriage, preterm birth, low birth weight, and fetal abnormalities. Having a balanced and healthy diet with at least 5 servings of fruits and vegetables a day reduces the risk of miscarriage to some extent. Also, preventing infections such as rubella lowers the risk of miscarriage. Consumption of unpasteurized foods put you at risk of listeria infection, and listeriosis increases the risk of miscarriage. Eating raw or uncooked meat, liver, and goose meat increases the risk of miscarriage due to an increased risk of toxoplasmosis. Eating raw or soft-boiled eggs increases the risk of spontaneous abortion due to salmonella. You can have caffeine, but no more than 200 milligrams per day. This slide shows the amount of caffeine in different drinks. For example, there is 100 milligrams in a mug of instant coffee, 140 milligrams in a mug of filtered coffee, 75 milligrams in a mug of tea. It is interesting that green tea can have the same amount of caffeine as regular tea. There is 40 milligrams of caffeine in a can of cola and less than 25 milligrams in a 50-gram bar of plain dark chocolate. Spontaneous abortion can be experienced in several forms. First, threatened abortion. In this form, the pregnant woman experiences spotting and sometimes pain. On examination, the uterine cervix is closed and the fetus is alive. Studies have shown that less than half of the threatened abortions lead to miscarriage. Another form is inevitable abortion. It is experienced as heavy vaginal bleeding, the passage of clots, and pain. The cervix is open, but the products of conception haven't been expelled. All of these cases can lead to complete abortion. The third form is incomplete abortion. It happens when some pregnancy tissue is expelled and some remains in the uterus, or maybe stuck in the cervical os. This causes painful symptoms that need medical attention as soon as possible. Missed abortion is another type of miscarriage in which the fetus is no longer alive, but the body doesn't recognize it and the mother doesn't have any symptoms such as spotting, vaginal bleeding, or pain. This type of abortion is most often diagnosed through an ultrasound. Last but not least is recurrent abortion, when a pregnant woman experiences 3 or more consecutive abortions falls into this category. It is really important to know the signs and symptoms of miscarriage. Actually, the main symptom of miscarriage is vaginal spotting or bleeding, which can vary from slight brownish discharge to very heavy bleeding. Other symptoms include cramping and pain in the abdomen, mild to severe back pain, the passage of tissue from the vagina, or a gush of fluid from the vagina, even without pain or bleeding. A small amount of bleeding during the first trimester of pregnancy doesn't necessarily mean having a miscarriage. If the bleeding is heavy or accompanied by pain like menstrual cramps, it is wise to contact your OBGYN right away. If a pregnant woman goes to her gynecologist with symptoms of miscarriage, the first thing that is done is an ultrasound exam. This exam can check whether the pregnancy is growing normally. If cardiac activity is not found, it may be too early to detect it. Or maybe the embryo has stopped developing. In this case, the gynecologist will order one or more consecutive beta HCG blood tests. If the HCG blood level is low for the gestational age or has a decreasing pattern, it indicates an abortion and the absence of a normal pregnancy. The OBGYN also may do a pelvic exam to see if the cervix is open. Dilation of the cervix means that a miscarriage may be more likely. If the pregnant woman's blood type is Rh negative, she should receive a shot of Rh immunoglobulin after an early pregnancy loss. This can prevent problems with the Rh factor in a future pregnancy. The next question is whether the treatment is necessary after miscarriage or not. After a miscarriage, some of the pregnancy tissue may be left in the uterus that is needed to be removed. There are options to remove this tissue. The choice depends on many factors, including gestational age and the patient's symptoms. If the woman doesn't show any sign of infection, such as fever, chill, or increase in white blood cell, the OBGYN may recommend waiting and letting the tissue pass naturally. This usually takes up to 3 to 4 weeks. Another option is to take medication that helps pass the tissue. With non-surgical options, patients may experience some bleeding, cramping pain, diarrhea, and nausea. An ultrasound exam is done after passing tissue and significant reduction in pain and bleeding to ensure that all the tissue has passed. If there is any sign of an infection, heavy bleeding, or other medical conditions such as anemia, surgery such as vacuum aspiration or dilation and curettage is recommended from the very beginning. In the vacuum aspiration method, the contents of the uterus will be removed with a suction device that is inserted through the cervix and into the uterus. This procedure often can be done in an OBGYN's office. The dilation and curettage method is recommended if the pregnancy is large or the bleeding is heavy. The patient needs to be admitted to hospital. In operating room, the cervix will be dilated and an instrument curette will be used to remove the remaining tissue from the uterus. Recovering from a miscarriage both physically and emotionally takes time. Depending on gestational age, pregnancy hormones may remain in the blood for a month or more. More women resume their period 6 weeks after miscarriage. In order to prevent infection, sexual intercourse and the use of tampon should be avoided for the first week or two after an abortion. During this period, it is important to pay attention to signs of potential complications and visit an OBGYN right away in case of warning signs such as heavy bleeding, foul-smelling discharge, fever, chills, or abdominal pain. Miscarriage grief is a real thing, but it is not something that's often discussed. Many of us get attached to our babies as soon as finding out that we are pregnant. So even an early miscarriage can feel like a profound loss. For many women, emotional healing takes longer than physical healing, and their feelings of grief may differ from those of their partners. To overcome this state of mind, it is recommended that the person expresses her emotions. Abortion is like the loss of a loved one, and it is quite normal for a person to experience sadness and despair for a period of time. Certainly, the support of family and others during this period plays an important role in improving a person's mental state. Joining groups such as pregnancy and infant support group helps mourning mothers emotionally and provides useful information and resources to cope with losing a pregnancy. It also helps them find a way to recovery and hope. And finally, the question is, how soon can you get pregnant again after miscarriage? You may get pregnant as soon as 2 weeks after a miscarriage, so it is wise to use a contraception method. If you plan to get pregnant again, talk with your OBGYN about the best timing for trying again. It's advisable to take time to recover emotionally and physically. Wait for a full 2 months to ensure that the pregnancy hormone HCG has reached an undetectable level, so it will not interfere with calculating the due date of your next pregnancy. Thank you for your attention.